Welcome to episode number 4 of this nursing specialties series, and today we're going to be delving into perioperative nursing. Then we'll be finding out what happens behind those operating theaters, what do the nurses do, what is happening when this patient is on the operating table, and everything that has to do with their salaries, certifications, etc. So if you're someone who's interested in becoming a scrub nurse, circulating floor, all of the above, this video is for you. So without wasting much time, let us get into this video. So perioperative nursing is a specialty focused on surgical patient care before, during, and after surgery. It involves patient safety, smooth procedures, and optimal recovery. And it is divided into 3 phases. First up is the pre-operative phase. This is when we're preparing patients for surgery and includes the following things. Number 1, the nurses need to assess the patient's medical history, allergies, and current medications, as this will affect the kind of anesthesia that the patient will be given, or more the quantity. And also some chronic conditions makes them a high risk patient during operations, and as a result, finding that type of information will help us to determine whether the patient needs to go to ICU or they need a high care setup, or they'll be okay after operations. So it's very important that at this stage you get as much information as you can about your patient, and patients that come with the written history of all their medical and surgical history, we absolutely love those type of patients. Secondly, you need to explain the procedure, the risk, and what to expect to reduce anxiety. So in most cases, the doctor would have acquired consent, or in most cases, the patient signed their consent forms on the day. And this is the time when you need to ensure that the anesthetist and the doctor have explained to the patient what is going to happen. And on the nursing perspective, we need to tell the patient what to expect during and after the operation. So before the operation, we need to tell them we're going to be doing vital signs, we're going to be getting the history to make sure that we have all the information that is important for this patient. And if there's other pre-operative things that we need to do, whether you're getting pre-medication, whether we need to shave the area, etc., and that sort of thing. And then also we need to explain to the patient what's going to happen after they come out of theater, how they're going to be feeling groggy, how they're going to be thirsty, why they should not be eating after the operation, and things like that. So this is just to help the patients understand what is going to happen after, so that they know what is coming, so that they're not anxious. Because in most cases, these patients is their first time coming to have an operation, and they are really nervous about what to expect. So that's our duty as the nurses. We as the nurses cannot tell the patient the risks that come with the operation. That is the doctor's job. So who sort of works in the pre-op phase? So the pre-op phase usually happens in your day ward, such as your surgical ward or even your medical ward, where you're pretty much just preparing the patient for this operation. And as a result, usually your med-surg nurses will be involved in this stage to prepare the patient to go to theater. However, there is some instances like your day clinics where they do day procedures. And obviously, your operating nurses will fulfill all these roles. You have someone on that specific day who is just doing pre-op checklists with an ENA, and then obviously the other nurses will fill into the other phases that I'm going to be speaking onwards. Okay, so now when it comes to the intra-operative phase, this is where all the action is happening, all the cutting, the suturing, the hammering, everything is happening in here. And there is 2 main sisters that we need to be aware of. So at this stage, this is where we hand over the patient to the operating theater. So whether this patient is coming from the pre-op room, or this patient is coming from a med-surg ward, or even ICU, whatever, and then we bring them into the receiving area in theater. This is where you hand over to the floor nurse, where you tell the floor nurse, this is my patient, and you do your general handover situation where you're looking at the ID band, reading the name and the folder number, confirming with both each other, looking on the prescription chart, or if you're in private, the iPad, to make sure that you're all aware of the chronic conditions that the patient has, any allergies, and also confirm when they last ate and drank something, and also making sure that they don't have underwear, socks, jewelry, etc. that will cause harm when the patient is in theater. And then you hand over the patient to the floor nurse. At this point, the floor nurses and the intraoperative team, they are now in charge of what happens to this patient. So after you hand over the patient, you need to now position the patient on the operating table and this would differ depending on what the operation is and also the preferences of the doctor. And also this is the time when your scrub nurse comes in to make sure that they are putting in their towels in the correct position, to make sure that the doctor and the surgical team will be able to maintain sterility and to prevent infection. So depending on how the patient is positioned, the scrub nurse will position her towels accordingly. And also the third thing is the anesthesia team is also now coming to sedate the patient. So the anesthesia team consists of doctors, and in some hospitals also nurses are involved. So on the doctor's side is obviously the doctor, the anaesthetist, would have had a conversation with the patient about their allergies, if they have any other history like alcohol abuse, if they have any medications that they're on that might interact with the anesthesia, and the anesthesia team would decide on how this patient is going to be sedated. And I've also spoken to other nurse anesthesias in a South African context, and what they've explained to me is their role basically is to assist anesthetic doctor, whether that's preparing the trolley, if they need any extra needles, if you need to bring in fluids, etc. The nurse anesthesia helps anaesthetist, but they don't administer anesthesia. However, like in your American context, there is actually nurses that have specialized in anesthesia, and as a result they're able to administer anesthesia. So you just have to understand those differences.
I'm a nurse anaesthetist.
How much do you make?
Last year I made $280.
How long have you been doing it?
2 years.
What educational background do you need to get into this?
You have to be an RN first. So I went to nursing school, and then I had to work in the ICU for at least a year.
Nice.
I worked there probably like 7, and then I went to anesthesia school.
Nice. And do you like what you do overall?
Yeah, I love it. Best decision ever.
Awesome. What are the pros and cons?
The pros is the money.
Yeah.
And the hours. The cons is a lot of responsibility.
Right. And how many hours a week are you working?
A lot. Anywhere from like 36 to 48.
Thank you so much for sharing. I appreciate it.
So after the floor nurse has received the patient, then the scrub nurse positions the patient and the towels to maintain sterility on the circulating table. Then obviously your surgeons will come in. They do the whole introduction. I'll put a clip here of sort of how it looks like.
Hello, my name is Dr. Sean Murphy, surgical resident, year 3. I will be assisted by Dr. Claire Brown on today's open appendectomy. I will not be putting on my number 7 sterile gloves myself, as I am lead surgeon.
Then after that, the operation starts. Then you have what is known as your circulating nurse. So the circulating nurse works hand in hand with your scrub nurse. However, sometimes you need extra equipment. The doctor says, for this patient, this is not going to work. We need something extra. Then your circulating nurse is the one that's going to run back and forth to fetch all this equipment. They're also in charge of counting the different suturing material, the different swabs and different materials that is used within the patient to make sure that nothing stays. So the scrub nurse and the circulating nurse, they need to communicate all the time. This is where all the magic happens, whether you're going there for a cesarean section, whether you're going there for a hip replacement, knee replacement, etc. And I know there's so many jokes that go around that like your orthopedic surgeons, they're more like the carpentry side of things because there's a lot of banging that happens and things like that. But this is the phase where you literally get to see all the action. You get to see the doctors in action. And in this phase, you see all the advanced technology, whether that is robotics that doctors are using to do these operations, or whether it's machines and cameras that they're using so that they don't make a big cut, or what we call laparoscopic operations and things like that. So in this phase is where you get to see, how skilled your doctors are and things like that. And it is absolutely mesmerizing to see them work. And then you also have other people coming, whether it's technicians that have to do with the fitting of a replacement knee or a hip knee. You also get your x-ray team can get involved, where the doctors want to make sure that everything is aligned so that every time they move something, an x-ray is being done and things like that. It is honestly a very, very, very exciting field to be in. So after the operation is done, then we move the patient to recovery. So we've covered the pre-op, the intraoperative phase, and now we are in the post-operative phase. So the post-operative phase technically has 2 phases. The first phase is when the patient is in the recovery room, where the patient has just gotten off the table and now we are recovering the patient. So whatever devices that the anesthetist use to keep the patient asleep, that's when they're taking all of those things in the mouth. So common complications that can occur in this time period is obviously airway obstruction, hypotensive state or shock, nausea and vomiting, and delayed awakening. And you need to make sure that your patient is stable before you hand them off back to the ward. So when will the patient be ready to go back to the ward? Is when they have stable vital signs, they are awake and alert, the pain is managed, and there's minimal bleeding or swelling on the area that was operated. And as a result, this usually happens between an hour to 2 hours of the patient coming out of theater. Okay, so as you can see, when people talk about perioperative nursing, most of them like to focus on the intraoperative state. Floor nurse, circulating nurse, and scrub nurse can all rotate between the three. Or sometimes you can just have a team of scrub nurses, and then your circulating and your floor nurses can either be your ENs or your ENAs. So for the rest of the video, I'm just going to be focusing on your intraoperative nurses and more specifically your scrub nurses. So where can your scrub nurses work in? So they can either work in a hospital theater, a dental clinic doing oral and maxillofacial surgeries. You can work in an aesthetic or plastic surgery clinic, like supporting elective cosmetic procedures. You can work in a cardiac catheterization lab, assisting in heart procedures like angioplasty, stand placement, angiograms, etc. You can work in a gastroendoscopy unit or your GI lab, helping with colonoscopy, gastroscopy, sigmoidoscopy, etc., which is minimally invasive procedures. You can also work in your day clinics. So scrub nurses can work in a variety of different places. It's not just limited to your hospital theaters, but that's where a majority of them are. So how do you become a scrub? So obviously you need to have some form of nursing degree, whether that's your diploma or your bachelor. And then in most cases, most of these nurses will start in your med-surg wards doing your pre-op and your post-operative care. Then you can eventually transition into your operating theater. We can just start with being a floor nurse, assisting patients, preparing them for theater. And then you advance a little further, becoming a circulating nurse, being in the actual operating theater, assisting with the scrub nurse. And then with more training and practice, then you eventually become your scrub nurse. Because being a scrub nurse, you need to have a lot of skill and you need to have good understanding of the doctors that you're working with. Because different surgeons want to have their procedures done in a certain way, and you need to be able to adapt. And also you need to learn a lot of instruments. You need to know what the instrument is. If doctor says I need so and so, you need to know what so and so is, where it can be found. And you also need to know how to plan ahead on time, because you know what the procedure is, and you also will know sort of what instruments your doctor or your surgeon likes to use, and you need to prepare all of those things in advance. You also need to know how to maintain sterility. You also need to be good on being on your feet for a long period of time, because these operations can take from anywhere from literally half an hour to 4 hours, and you need to be able to be strong to stay in there. I know sometimes they'll have scrub nurses that can swap in and things like that. And also you need to be able to remain calm, because things can get hectic in that operating theater, especially when surgeons are frustrated that things are not available when they want them. You know, surgeons can have a lot of big egos, and you need to be able to handle that and deal with that effectively. But also just having that good, synergy with your surgeon of, when he wants this, how it must be handled and things like that. There's a lot of precision that comes with being a scrub nurse, but it is honestly a very exciting field to be in. You get to see a lot of different procedures. You get to see life for the first time. And you also get to see patients dying on the operating table and that sort of thing. So there's a lot of juxtaposition that happens in the operating theater, but honestly, there's a lot of action that happens there. That's the thing that excites me the most. So after you get your degree, you end up in the operating theater. You can actually go to school and get a postgraduate diploma in perioperative nursing, and this will just give you more information on how to be a post-operative nurse. But in most cases, these things you learn on the job. And also you need to have extra certifications, your BLS, ACLS, PLS, and all of those things, because if anything happens while you're in the operating theater, your patient goes into shock, your patient goes into cardiac arrest and things like that, your certifications, BLS, ACLS, and all of that will help you to know what you need to do, you know. So if this would be a specialty that you'd be interested in, definitely comment down below and let me know. Also, if you're a current nursing student, let me know, have you had your operating theater rotation yet? What was your thoughts? What sort of procedures did you experience? If you go down on my channel under shorts, there's a video that I did of my experience in there where I made quite a big blunder during an operation. Absolutely embarrassing, but I think it was funny and just highlighted, you know, what operating theater is like. So yeah, so if you missed any episodes from this series, I would highly suggest that you go catch up. You can find the videos over here or over here. Until next week Friday, 12 p.m. South African time, have an awesome one. Bye guys.